Hello there, I'm Sinead from the Birth Partner Project, and I'm going to talk you through using a document that's being created for helping to verbalize mum's birth preferences and get them written down. This document's to be used alongside the birth preferences presentation that I will link below. So you can print this document off, and while you're sat with mum, maybe with an interpreter, going through that presentation and noting um, her preferences on this sheet that can be brought in with you when she goes into labour, should she be birthing in a hospital setting or birth centre. So the document starts off very simply with mum's name, the languages that she speaks, contact number, expectant due date, the name of her community midwife, and I suggest maybe writing her number there as well, and her preference for the place that she is going to be giving birth. Going over to the other side, important to know, this space has been created for kind of any allergies or maybe phobias that she would like to have mentioned, maybe medications. So, for example, someone who has diabetes, that should be noted there. The space below is for all the contact information of every member of her birth partner team. And then we go into the specifics. So, that light pink box underneath environment, you can write a kind of summary. And then the darker pink box is a space for maybe bullet points or free flow kind of thinking, writing rather, around the ideal optimum environment for this mum. Um, the next is monitoring. Her preference is around monitoring, pain relief, birth positions, any interest in having a birth pool, um, the second stage of labour, and the environment within the labour ward. So, again, using these alongside the presentation, so much to explore, a lot mum might not have even considered as having options around. So, it's a really good chance to explore all those different options. Next is assisted delivery, should that be necessary. Um, what is mum's preference? The third stage of labour, and then there's a really large space for unplanned caesarean, should that need to happen as well. And as a birth partner, this is really good for you as you might be asked to help cut baby's cord, or help change baby, or hold baby next to mum's face while she's on the table. Um, and what's her preference around that, or would she prefer the midwife to be more hands-on, or lots of different lots to explore in that section as well. And it's good to think about this in a very gentle, tentative way, and for mum to always come back to feeling very empowered and that she's making um, her requests known rather than ever feeling um, scared or fearful around giving birth because of this. That would be counterintuitive. We want this to be a very empowering exercise. And the last page is anything else. So this could be used in any way that mum likes. Um, yeah, so just plenty of space there for you to use together. I hope you enjoy using this document with the women that you're supporting and that it can be used as a way of bonding, getting to know one another, and to help her feel really empowered and prepared for giving birth. If you have any questions, as usual, do get in touch. I will drop the link to this document below so that you can print it off, and do get back to us if you need any printing costs reimbursed. And if you have any questions at all, please lean on your birth partner team members, other volunteers, or get in touch with the staff. We're all here for you. No one has to be thinking that they need to know everything or do anything alone. Okay, good luck.